Congratulations! You're pregnant! So now you're probably nauseous, you have to pee every 10 minutes, and you're totally stressing about the actual birth. Luckily, you don't have to suffer through the next 9 months. We've got experts weighing in on the very best life hacks for nailing your pregnancy. Fireball. Okay, no, not this kind. This kind. You've probably heard that ginger tea soothes nausea, but did you know that hot tamales and atomic fireballs get the same results? Reproductive endocrinologist Dr. Amy Evazadeh says, herbalists have long known of the power of cinnamon, and many recent published scientific studies are also demonstrating the same. Cinnamon is a side effect-free way of reducing symptoms that are so commonly seen in pregnancy. She adds, I tell patients to suck on the candy and don't necessarily eat the entire thing. But just warning you, after pregnancy, you may have a really hard time eating a hot tamale again. But if you're sweating the heat, there's another option. Unisom. Beat the nausea without a prescription. Dr. Amy says, quote, you've heard of Kim Kardashian marketing Diclegis for nausea. It's pregnancy category A, which means it's safe for your baby. But if you need relief in a pinch, taking Unisom with B6 is almost just like Diclegis and no prescription needed. Unisom tabs are super small and easier to swallow, so they may work better. However, Dr. Amy warns, before you try any of these pregnancy hacks, do talk to your doctor. Severe nausea could be a sign of untreated hyperthyroidism, and that's something you'd want to know. Stimulation. Gotta go with nowhere to go? Bailey Gaddis, birth doula and author of Feng Shui Mommy, says if you're ever in traffic with a full bladder, redirect attention from your bladder by using touch techniques. She says, quote, if you're not the one driving, direct attention to your arm by lightly grazing the back of your fingertips across your arm. This light touch helps to stimulate your nerve endings and release endorphins. If you're the one behind the wheel, lightly graze one thumb across the side of the other. Or maybe you actually want to stimulate your pee. Peppermint oil. If you're having trouble peeing, Gaddis says, pressure on the bladder and swelling in the vaginal region makes it difficult to fully empty the bladder. My #1 top secret tip that all my pregnant clients love is to put a few drops of peppermint essential oil in the toilet bowl if you ever have trouble urinating. Peppermint oil is so effective because its vapors help to dilate the urethra. This tip is especially helpful during childbirth when the pressure on the bladder and swelling in the vaginal region is greatly intensified. Relax with your main squeeze. Use that baby-related restless sleep as a chance to bond with your partner. Gaddis says, to ward off insomnia, tell your partner it's essential to practice birthing relaxation techniques like pressure point work, light touch massage, scalp, jaw, and foot massage, and guided meditation together before bed to ensure you're both fully prepped for birth. Doing these relaxation techniques has multiple benefits, Gaddis continues. Not only can this get you nightly massages, but it will serve to deepen your bond with your partner, fill your birthing toolkit, and help you drift into deep and restorative sleep. Meditative meals. Meditating before meals can help you make better food choices and stay healthy throughout your pregnancy. Gaddis recommends meditate for 3 minutes before preparing any meal or going into a restaurant. When you take a few quiet moments to clear the mind before making food selections, you're more likely to tune into what your body actually needs and desires instead of what your mind is saying sounds good. Singing along. Trainers often suggest the talk test, in which you see if you can talk comfortably during exercise in order to measure the intensity of your workout. But according to Helene Byrne, internationally recognized prenatal and postpartum fitness expert and founder of BeFit Mom, the Sing test works even better. She says, when we speak, it's far too easy and common to take small, barely noticeable inhalations. So while you may not be outright panting, you can unintentionally overshoot your ideal prenatal aerobic training zone without recognizing it in your body. Here's what she suggests instead. Sing a simple song like row, row, row your boat, and if you need to take a big inhale between the first 2 lines, then you should lower your intensity. To the core. When you have a baby occupying your uterus, it's common to experience pain. But you can set yourself up for a smoother 3rd trimester by doing prenatal core exercises. Byrne recommends prevent common pregnancy problems like diastasis recti, pelvic instability, and back pain with simple prenatal core exercises that build and maintain strength in the transverse abdominis, or TVA. The TVA is our body's internal corset, and when contracted, compresses the abdomen. Performing these safe moves throughout pregnancy will not just prevent or lessen the severity of these issues, but will also greatly aid in the pushing phase of labor, as the TVA is our primary voluntary expulsion muscle. Yoga ball. Lessen the chance of episiotomy or vaginal tearing by exercising on a yoga ball. As Byrne describes it, when you straddle a large exercise ball, your pelvic floor is in contact with the ball. As you exercise on the balls, whether simple stretches with free weights or stability moves, the membrane of the ball and your pelvic floor will function as one unit. As your weight shifts on the ball, your pelvic floor will undergo a small amount of upward pressure, which gently stretches your pelvic floor muscles, which builds elasticity. In addition, Byrne suggested after 36 weeks gestation, you can gently bounce on the ball for 5 minutes a day to more effectively build elasticity in your pelvic floor. Practicing Kegels on the ball is great too. Thanks for watching. Click the list icon to subscribe to our YouTube channel. Plus, check out this other cool stuff we know you'll love too.